At this point, we wouldn't recommend walking around in this area simply because there's so much change in elevation and we've only got the walker and one leg at this point. It's no good. So we're gonna have to drive all the way up here and park on this right-hand side where we'll have plenty of space to get out of the driver's side door.
Go ahead and open that door.
Let's open that door.
Perfect.
Look at that. Look at all that room. We can scooch the seat back and we should be able to get the walker over the center console. Once you get out of the car, we have two options. We can either take these garage stairs or we can take the stairs to the front door. Let's take this path and see where it leads us. After we go over this little ledge right here, which may be a little problem for the walker and for safety because the elevation change is so steep, we're gonna get to another big problem. And that's the fact that there is no rail right here at the beginning of these stairs. And they're two very steep stairs. To get up here with a walker, we would need to press in. We'd only be on one foot and we'd have to do some sort of hopping maneuver like that, which is probably much too difficult. Once we get to the top, we have a non-skid welcome mat, so that's great. It's not really a tripping hazard at all. But then we have a pretty significant ledge to get inside the house I think it's about 3 or 4 inches. You would have to do a maneuver like this, and then you'd have to jump in like this on an unstable surface. So that's not great, having to land right here to get up. Let's show you a better way.
The reason we think this is going to be easier actually does pertain to the narrowness of the space. As you can see, my hands are both resting comfortably on these rails, and the patient, using his walker, depending on preference, I would coach him to use the rail that allows him to get a full grip. He can ambulate using one leg, placing his device, and hopping up much more easily than he did, especially on the first 2 steps transitioning into home from the outside. An alternate strategy for the patient once they reach these steps that are again much taller than the others anywhere else in the house would be to take the patient's walker and set it on the inside of the threshold as they use the doorway to lower themselves to the ground and scoot across the next entrance. The patient can continue doing this all the way up and retrieving the assistive device as he ambulates through the playroom. So, coming in through here, you can see that there are no doorway transitions in here, and also there's a guest bathroom over there that the patient doesn't use very often, but still no transitions, no slippable surfaces. All the floor is vinyl, no transition into the bathroom either, and this rug actually does have a non-skid pad underneath as well, no corners upturned, and it's secured by a piece of furniture. I might suggest that the patient secure it under the bed as well, or move it to another room and get a larger rug altogether, just to prevent slipping, but for now this is relatively safe. Coming into the bathroom, no immediate fall hazards, again on the ground, open space to the tub, and this rug isn't exactly ideal, even though it is non-skid. You can see that it doesn't fit in this space. Doesn't look like it would come up as the patient stepped out, but I would probably suggest either modifying it by just like cutting it off, cutting that corner a bit, or getting a smaller pad to fit the space better, but no inherent fall risk just from the rug itself, but the placement isn't ideal. This is the patient's primary closet, which also has adequate access. Fitting a walker to navigate the space may be a little tricky, but you can have it at his side. Transition laterally, using the doorway for security as well. I would suggest a chair in here. There's a blank wall space right here. You can see that would be perfect for the patient to have like the small chair we've been using as a walker right here to sit down and get dressed after he finished his shower. Speaking of which, has no shower seats. So that would be the biggest modification we would recommend for for this time, especially since he doesn't have his prosthetic immediately after coming out of the hospital. Normally about 2 to 4 weeks or so before the fitting even occurs. So it would be wise to have a modification for him to be able to shower in the interim. That being said, if he did use the bath, the same might be true. If not, we would at least want a rail so he could be able to push himself out and not have to rely on the potentially slippery bathtub itself. The toilet, patient could use this as a sort of rail to stand up after doing his business, but maybe would want a second one over here in the interim while he only has the one functional extremity.
Now we're going to be looking at the rest of the first floor area where the patient is going to be during this point in rehab. This is the kitchen area, so it's nice and open. We've got vinyl floors again, so that's great. We do have this little rug right here. We would advise just removing this at this point, just because it's going to be easier to maneuver the walker if we have one stable surface here without the rug getting in our way. The good news is we have plenty of room to maneuver the walker if the patient wants to, wash their hands in the sink or grab something from one of the cupboards or even go over to the fridge. So that's great news, and everything is at about hip level right here. We'd make sure that we put cups and other stuff on a reachable height so the patient doesn't have to strain at all to get up there. So everything in the cupboards we would move down for sure.
This room specifically, all the rugs are tacked down, as you can see on this side and this side. I believe there's a bit of a lip on this one, but it is secured by furniture on all sides. So we would want to secure this if it were staying up here. Same for this rug as well if it were staying, but apply all of these things to the downstairs living space since we do want the patient to live on one floor to minimize the amount of ambulation he has to do just to live his life. So the seats we could possibly move and allow a little bit more space between the table, the couch, and the chair to allow the patient to get in with his assistive device, since that requires a little bit more space. But even entrances to seating as you come across this way, as you come around, have adequate clearance for standing room, but maybe again still not walker, but we wouldn't advise that the patient approach sitting in the room from this side. So generally speaking, tripping hazards are the stairs, the thresholds in the closets are fine, but the rugs are not tacked down.